So, as you can understand that India is a, of course, big country, everybody knows about it, and we have a healthcare structure which is overburdened to a certain extent, but certain places it is underutilized, at places it is overutilized. There are hospitals in the tier 2 cities, tier 3 cities and villages which are empty. And there are hospitals which are overflowing. So which means that it is not equitably distributed. And the problem is that the death rates around the world and in our country is also declining, but the birth rate is also not coming down. So that is why we have people who are living longer, and that is why we are having diseases which need to be treated in patients who are, or people who are living longer. We have problem of infectious diseases, but we also have problem of degenerative diseases like heart diseases. And that is what I do on a day-to-day basis, treating heart diseases. Why heart disease is so important? Because it is considered that heart disease is one of the worst epidemics at this time, and 2 out of every 5 deaths happens because of heart disease. So many hospitals for heart disease are coming up, not because that heart treatment makes more money, because we need people, we need treatment for those people who have heart disease or who are at the risk of dying because of heart diseases. So that is why there is a need of heart specialists, there is need of heart hospitals in big cities going up to tier 3 and tier 2 cities where it is still not available. And that is why many times, as far as I can tell you, I see patients coming from all parts of North India in Gurgaon and in Delhi. Why it is happening? Because enough facilities or enough trained people are not there. So we have to educate people to use the facilities which are there. I understand that they are scanty facilities, but still they are not properly utilized. Still there are heart centers where enough patients are not reaching. So they are not being utilized because people have the education level of using these facilities or treatment is not there. And as you already know that in India we have this problem, and all this is because the literacy and the GDP per capita which is being invested and the longevity of our patients, all this has come together to keep it, which is keeping India at a very low rank of HDI, which is Human Development Indicators, as many of you might be knowing. So this is where we are. The problem of health in India is huge. It is almost the same as in Western countries, but the resources we have is so little. So that is why so much hue and cry is happening, and we are still trying to struggle and also have these kind of programs which probably will help take it forward. The expenditure on health in India is very, very low, as you already know. I don't have to say more about this. Of course, some thought is being put forward and some programs have come forward, as our Minister, the Honorable Minister has already mentioned here, and you already know about this from the schemes which have been launched, but still all that has to be implemented. It is still not there. And as you can see here, that in our country, the death rates compared to other countries is very high, especially in the younger population. Between 30 to 60 years of age, which is the most productive age, the chances of dying is very, very high. Why it is happening? Because we have serious problem of diabetes and heart disease. So we have serious problem of diabetes and stroke, which is leading to this problem. And we need to have facilities where this can be treated and this can be prevented. So this is what the situation is like now. The good hospitals, or where it is available, everybody is flocking there, and there are hospitals where the patients are not able to reach because they don't know about this, they don't have the education to do that. So that is one part of it. The second part of it is that these facilities, these treatments are expensive. And when people have to, because the mindset in India is very different, that if somebody has to spend for health, they won't like to do that, and they will think that their money is being snatched or taken away. But if they have to spend for a car or for a wedding, they are quite happy about it. Many times, let me tell you, patients come to us saying that don't do my treatment because I have my other things to be done, which is like doing a wedding where they will spend 10 lakh rupees, 20 lakh rupees, but they are not ready to spend 1 or 2 lakh on their health. So health is not a priority for many, many people because they are not educated to understand this. The education or the culture in our society is that it is very important to spend more money on wedding or spend more money on building a house rather than spending more money on building their health. So this is a big problem, and when this disconnect is there, they start crying, they start shouting, they start making all kind of issues that they don't want to spend money on the health. And nothing comes free. Everything is costing money. So that is what has to be understood. And so that is why there is need of health insurance, there is need of government to spend more money on health and bring hospitals. And the discrepancy is that at this time, 70% of healthcare is being done by the private healthcare, which has come, which has really taken things forward. And I will show you in some of the slides what has happened. That we have reached a point where nobody from India has to travel outside, which was not the case 30 years back. 30 years back, every heart patient had to travel out for treatment or die inside the country. I can tell you. And today, you should be proud of to know this, that no patient from India has to travel out of the country to get treatment for heart diseases. This is the situation as of today. But we are not able to project this. This is the problem. Everybody is trying to say, doctors are taking money, hospitals are taking money. Nobody is saying that you don't have to spend 20 lakh rupees to get a treatment done like bypass surgery, which we used to do 20 years back. Doctors from US and UK used to come here in India. They were doing OPDs, they were screening patients, and they were going to Houston and many other cities. There were hospitals who were actually running on Indian patients in US 30 years back. But today, nobody has to go, not even ministers, not even bureaucrats, not even the people who can afford anything in life. So that is the positive side of the story. It has not happened overnight. It has happened because everybody tried. And private people invested money in this. They thought that it is important, and there is so much data saying that the healthcare industry is a sunrise industry because it is need of the society. And we have to get investment from private sector, from government to bring things forward. Today, nobody has to go out of the country for cancer treatment. Earlier, everybody was going to New York, or there was only hospital in Bombay. But today, every city, in Delhi, nobody has to go to other city to get a treatment for cancer. So this development has happened because we have tried to do so. Let me tell you about the training part of it. Every cardiologist had to get trained outside this country when I got trained. I had to go out of this country because there was no way I could get trained for angioplasty. But today, there is no doctor going out of the country for any training. In fact, if you come to my hospital or many such hospitals, we are a private hospital, we get doctors for training from at least 5 to 6 countries every time. I have got doctors from many, many countries for training, and of course, Indian doctors are there, and which says that the reverse thing has already started. 20% of our patients in big hospitals come from outside the country. Why? Because we provide good health care. We provide good treatment for these patients, which is at par with anywhere in the world. This is the situation right now, which we have to understand and also propagate. We don't have to say that a patient was admitted where 20 lakhs was spent and he didn't survive. It could happen. Doctors are not gods. They will try. And despite all this treatment, some people will die, and of course everybody has to die at some point in time. So we have to look at the positive side of the story, and we have reached a point where healthcare has already taken a positive direction. It needs support from everybody so that we take it forward. And of course, one of the understandings which has been already said in the previous presentation and discussion, that we have to work more towards prevention. And as has been said by many, many people, that prevention has to be done at all levels, including our own understanding, our own families, our own selves, that we have to look at promoting healthy lifestyle, because all these diseases which are killing us at young age is lifestyle diseases. These are known as lifestyle diseases, where if we don't take care of ourselves mentally and physically, then we will go into the problems of heart diseases, and heart diseases is the biggest cause of death in and around the world, and basically it is affecting both developing and developed worlds. So you must understand that many, many people who die early is basically because of heart diseases and diabetes. So to prevent that, we have to do all these things like physical activity, exercise, diet control, and stoppage of smoking, which is very, very important. Then, so many tests are now available in this country. Many times patients, when they are not improving, they come and ask me, doctor, can you get some medicines from outside? Can you get some doctor from outside? Can you get some investigation from outside? We have to tell them repeatedly, there is no need. Everything is available. But of course, these things cost money, and that is what the disconnect right now is. That we have to understand that these advanced treatments will be costly. They of course has to be rationalized, but we have to use it in a way to our patients that they get to everybody and whosoever needs it. So rational use of drugs, because a lot of antibiotics and other treatments are being used without proper knowledge by many physicians who are not properly trained, like the non-MBBS doctors and other specialities where they use the drug and then people become resistant to that. So when they come to us, everything has been used in an improper way, and that is the problem right now. So healthcare is a serious issue which needs to be addressed, which needs to be looked at very carefully. We just can't have a improper view over this very important problem which is coming to our society. Of course, we have our wish list for our patients, that we have to get the best technology. For our patients, we have to get good trained doctors for advanced treatment, and of course, everything should come at an affordable cost. Because the problem is that 70%, 80% of our patients cannot afford even a square meal many times. So the problem is widespread. It is not only for healthcare, it is a widespread problem which has to be addressed in a graduated fashion. We can't have an answer today. So there are so many models which are coming up, like the private-public partnership models, like making drugs in India, making devices in India. And let me tell you, the drug industry has also come to a very good level in India, where a lot of drugs are being made in India, and they're very high quality, and the cost of these drugs is at least 1/10 the cost of what it is in the Western countries. So this is the situation. The Indian healthcare capabilities have increased. We do a lot of all these treatments for heart diseases, brain treatments, transplantation. Everything is being done, and all is being done at 1/10 the cost. I'll just show you a comparison how it looks, that how does it compare with the other countries, the cost advantage. The cost of doing a surgery, bypass surgery or angioplasty in India is at least 1/5 the cost of this treatment anywhere in the world, be it developing countries, be it developed countries. So this is the positive side of the story. But we have to still try to bring it down as much as possible and make it possible for more people. So this is the paradox of this country. We are the cheapest, but we want it cheaper because even the cheapest cannot be afforded by so many people. So we are still working on that. A lot of things are being done, and that can only be done if we have more research. And all research can be done if we have more, support for that, more intention to do these things. So the Indian pharma industry is very, effective now. It has got so many drugs which can be used. So with all this, There are challenges, that there is loss of faith and mistrust, which is being pushed also. Everybody, because our society or in any society, everybody wants to enjoy the negativity of the whole thing. If there are 10 positive cases, nobody is interested in that. But there is a one negative case, everybody will start talking about it and not talk of what has happened up till now. That we are saving so much money which used to go out of India is now being in this country. And let me tell you, what has happened is that so many pharma industries which were from outside the country, the multinationals, have actually run away because they are not able to produce drugs which are at such cheap price. And these drugs which are made in India are very, very good, I must tell you. So we need to have better policies, we need to have more facilities by the government, and of course insurance, state sponsorship for the patients will really take it forward. And we have reached a point where healthcare is really at par in sense of quality. Now we have to increase the reach to more patients, and of course these programs will help. And the way forward is that we must have more health education, more paramedical training for nurses, for technicians. We need to have more people who are getting trained, more institutions. And of course, standardization and quality control also has to come in, because not every hospital is the same, not every a specialist is the same, so all that has to be monitored. And quality control, the private sector, which is really turned the tables, 70% of the treatment is being done in private sector, so we have to help them go ahead. If a model has worked, let us help them. Let us not criticize that private sector is taking away everything. Private sector is helping everybody. More people are living because this treatment is being offered to them. And the myths have to be removed that when you pay money, it is like a loot which is happening. It's not that. And more research needs to be supported so that more new drugs, more new devices can come to the country. Thank you very much.